Let's talk about anxiety and depression. They both kind of go hand in hand. Oftentimes one leads to another, or they simply cohabitate in our minds. First and foremost, it should be recognized that while it may be easy to accept that the heart, lungs, kidneys, and liver can be sick, it can be challenging to accept that the mind can be sick as well. Indeed, the brain is an organ as complicated as the universe with just as much mystery. Now, when it comes to depression, there's the normal ups and downs of life. This is normal, and it's actually healthy. If we never feel down, feeling well can't be recognized. But there's a different kind of depression that's dark. What differentiates this kind of depression is a few things. 1, it lasts for many days. It can last for weeks. 2, it is disruptive. Time off from work, missing family functions, ignoring major responsibilities are obvious things. More insidious signs aren't as overt. Persons with this level of depression may appear happy otherwise, sometimes even joyful. But there's a darkness that is pervasive in their life, and frankly, sometimes it can't be known unless the person says something. 3, it can be deadly. I'm not simply talking about suicide. Behaviors such as drinking, using drugs or chemicals, and violent outbursts are some examples. As one can tell, this can be challenging. Being deadly doesn't simply mean ending one's own life. It can also mean being destructive in a way that diminishes life in general. Overeating is an example. I've said for years that persons who are extremely morbidly obese likely have undiagnosed depression. They are simply treating with food. It's the drug that never lets them down. As someone who used to weigh 450 pounds myself, I feel like I can say that with a commanding authority. I remember when Robin Williams died and how it shocked the world. Among the many gifts the late actor left us, his indelible impact on how we all view depression made us all stop and realize how very real it can be. There are 3 pillars of mental health, and here at Harmony, we believe that investment into each of these areas is necessary for success. The first pillar is medications. We will be discussing this in greater detail shortly, but many of us know of people who have tried mental health medications and know how frustrating it can be. Frankly, it's frustrating for prescribers as well. Anywhere else in medicine, we expect precision while prescribing, but not here. Mental health has a long history of having chemicals thrown at it. Then we rely on subjective responses from the patient. Do you feel better? Medicine tends to get very judgmental if a urinary tract infection is treated this way. In fact, whole protocols are written over UTIs. Depression, not so much. Fortunately, we have tools that can help us be more precise. We will be discussing these options in a few minutes. The second pillar is a support system. And here's the important part. It cannot be family. Many times, the reason people are in these exam rooms discussing depression and anxiety is because of family. That means your support system cannot be a family member. We all need friends, and we all need a support system. We are social beings, and solitary existence is not good for us. The third pillar is counseling. This option is often scoffed at, but don't be quick to dismiss. All I ask is that you just keep an open mind. Here are some last thoughts about anxiety. Many times people look to a drug to help them with anxiety. Some drugs we use to help with anxiety are safe for long-term use. Alprazolam, clonazepam, diazepam, and lorazepam are commonly prescribed for long-term use. However, we strongly discourage this. Many people do not know that these drugs use the same pathways in our brains as alcohol. In short, taking them is the same as drinking a glass of wine or a shot of whiskey. Dependence on them to change the way we feel can be very dangerous. Finally, we often encounter working adults who seem to pathologically load their plates with so many tasks, they set themselves up for failure. So when they go to bed at night, they feel like failures. This makes them anxious, and we actually call this adult ADHD. Sometimes it's better to treat the cause of anxiety rather than mask it with a pill. As you can see, there is much to discuss. At Harmony, we want you feeling your best so you can be your best. We will be with you shortly in just a few minutes. Relax and experience healthcare done correctly.